Hi, everybody. I'm Dr. Lisa Bryn, previously Dr. Lisa Erickson, and today's workshop is a repeat of one I did several years ago that people super enjoyed, that I was traveling and doing this at climbing gyms. And now with COVID, I'm offering this online. So today's topic is preventing climbing injuries. And we're zooming in on your upper arm, right? Your fingers, your wrists, your elbow, your shoulder, and just looking at the most common climbing injuries and how to prevent them. Hi, everybody. I'm Dr. Lisa Bryn, formerly Erickson, and today is a oldie but goodie. I used to present this presentation at climbing gyms back before COVID, and now that I'm not traveling and we can do things virtually, I'm inviting you to join me on today's lecture of preventing climbing injuries, and we're zooming in on the upper arm and research and injuries and prevention of said injuries. So, a little bit about what I'm going to talk about today. We're going to talk about research and injury statistics, specifically with climbers in mind, discussing how to educate friends and fellows, and also how to keep ourselves educated, and then tools to help us to heal and not be injured as much as we have been. Who am I? I'm a sports-specific climbing specialist. I worked in the past with USA Climbing and used to travel with them, and now I have a climbing-specific clinic, and I do virtual coaching as well as ordering MRIs, X-rays, and giving you guys health, homework, rehab, and that type of fun stuff from virtually from anywhere in the world. So specifically, I am a problem solver, and I specialize in injuries that you guys have that the basic PT or orthopedic doc can't fix because they're not, one, familiar with our specific lingo and terms, and two, they're also unfamiliar with the load and the angle and the torque that we put into these small joints with our sport-specific loading that we do, and then three, how to rehab you so that you can get you from injured to back to climbing again. And the reason why I'm pulling all this out of the history books, is this being an old lecture, is that I am currently working on info for my latest book called Return to Climbing. So my first book was Climbing Injuries Solved, and that book was specifically on injuries that climbers sustained. And now, with all the wonderful feedback you guys have given me and questions you guys have asked me, my next book that I'm currently working on right now is called Return to Climbing. And that takes you from your injury to where you've taken time off and you're now healed and you're now ready to get going again, or perhaps your injury is still slightly talking to you, right? And how to get from that point to the point that you're able to actually start training for climbing, right? You're not ready to hangboard, you're not ready to go back and repeat that project. Like, where do you go from here? And that's kind of where my specialty arises. So let's look at some major injury statistics. This photo is a previous athlete of mine, Daniel Woods, and I just love how he's using all of his fingers beautifully as he pulls, right? He's not just going for two fingers. But injuries are kind of high in our field, which is why I'm here. And why Jared Vagy's here, and Ask Dr. J, Dr. Julian Sanders is here, blah, blah, blah. So studies show that we have quite a few injuries. However, they're not very serious, okay? So a serious injury, which is one that you need to ride in an ambulance or go to the ER, is relatively rare, okay? So this statistic, 1 out of every 3,000 hours spent climbing, that's not just hanging around doing easy climbing. This research is based on competition climbers, and so that's actually a really good stat. Looking at other sports that are out there, right? We see injuries all the time when they're galloping around on the field in football and basketball and soccer. We're just so lucky and fortunate that we don't have these major injuries, right? But with that said, we do have a lot of injuries, which is probably why you're watching this in the first place. So with a bunch of previous research out there, I'm just kind of looking at the references at the bottom. 1 out of 5 of us have a climber's finger, which is a pulley injury. Every other climber, right, 50% of us have tendonitis somewhere in our arm. Over half of us, these injuries are in the finger and hand, and then most of us, 90% of us, have more than one injury, okay? So what is this telling me? This is telling me that something is wrong with our training, something is wrong with our approach, or something is wrong with our recovery strategies, right? Like we're missing something, okay? This amount of injury prevalence that is stacking up is kind of a problem. So when I meet with you guys one-on-one virtually, usually you guys start with your finger, and then as I start asking questions about your finger, it all of a sudden becomes clear that you also have an elbow injury, and perhaps we're cheating and guarding for a past shoulder injury. And so these injuries kind of collect if you don't know how to do self-care and to work on yourself, which is why I'm taking the time to reach out to you, because one, friend, I want you to heal, and I want you to learn how to work on yourself, and I also want you to understand the mechanisms of injury. And going deeper into that, the reasons why your injuries aren't healing, and we're collecting them, okay? There's several reasons for that, and we're going to go into that in a minute, but yeah, just looking at this slide, we are injured as a whole, right? Like 90% of us have more than one injury. That is not something to be proud of. So why, right? The question we have to ask ourselves is, why are we so injured as a group, as a sport? We tend to be, how would I say, high energy, aggressive, pushing towards being better, faster, stronger, be able to climb with less fingers, right? But there's a lot of newbies in the sport, but that doesn't have a lot to do with the statistics I just went over. Perhaps we're afraid of MDs. A lot of my clients that I see that talk to an orthopedic doc or go into a hand-specific surgeon, you may have heard this before. Oh, you just need to stop climbing, right? Climbing is hard on your fingers. You are degenerating rapidly. You're wear and tearing faster than you should be as a climber. Well, yeah, duh, but I still love this sport, right? I'm not going to give it up just because I have a bone spur here or there, or like something is worn out. And every medical provider is going to give you different recommendation, right? And take it with a grain of salt. But if you were my brother, or if you were my sister, I myself, my own strategy is I'm going to take as good of care of my body as possible. However, I'm expecting things to get damaged and injured in going out there and having a good time and really pushing myself. And that is just something that comes with being alive, right? And I would rather myself personally to use my body in a way that beats it up, but I'm still enjoying my life, versus sitting on the sofa being that protectionistic person. Is that a word? Protectionistic? Probably not. But being that guarded, protected person who is afraid to do things because you're afraid of getting injured, right? We need to walk that fine line of what is an injury, how to take care of it, how to push and progress ourselves in a way that is supportive to our tissues and our end goal, right? In our best interests, and not a short-term goal of today. I'm all hyped up, right? What are my chemicals telling me, right? I've got adrenaline, I just got a big dopamine hit, like I am pumped up on chemicals and ready to do something crazy, right? My music is awesome. I love this song, oops, I just hurt myself, right? So is it a self-control thing? Or are we just not returning back to climbing once we've been injured, right? What is that transition? And then finally, my last question as to why we're always injured is, are we just kind of keeping this to ourselves as to how to heal? 10 years ago, I used to think yes, but now that I'm online and I'm spending more time going through different coaches' hangboard recommendations like Eva Lopez or the Anderson brothers or Rock Warriors Way, training for climbing, like there's a lot of really good information out there, and people are trying to share their knowledge, me included, as much as we know, right? We're really knowledgeable about some things, not so knowledgeable about others. Like this beautiful collective knowledge that we have as a sport together is awesome. And I love that we're starting to share that and work together as a team. So yeah, good question as to why we're so injured. I personally think it's that we get too hyped up and we're focused too much on our short-term goals comparing ourselves with Instagram and like the fear of missing out of what everybody else is doing, how quickly everybody else is progressing, and not paying enough attention to our tissues of where am I today physically? What is my strength? How well can I control my fingers, my hand, my shoulder? How strong am I, right? If we start loading on the wall and then all of a sudden you get to this fatigue point where your technique falls apart, you start yanking and thrashing about on the wall where you're barn dooring everywhere and you're really over gripping and you're pumped out, is that really in your best interest to be climbing through that? And for some, in their training regimen, absolutely, right? With some of our training plans for our workout for that day, our goal is to beat ourselves up. However, for the rest of us that may not have a training plan or may not have walked into the gym or out to the crag with that specific goal in mind, we need to just mentally take a step back and think, what was my goal of coming out today? What is my goal for the end of the season? What is my goal in the next 3 or 4 years, right? I really am pushing you guys with your goals of what is my 3-month goal? What is my 6-month goal? What is my 1-year goal? What is my 4-year goal, right? And then we create our training plan based on that and with supportive homework and exercises to get us there, okay? So the biggest mistakes I see that I've had you climbers actually tell me, and it's funny because if you're listening to this, awesome. But if you're actually looking at this, I have a photo of a USA climbing competition. I think this was in Madison, Wisconsin, and this guy wrote pull hard, pull on his left hand and hard on his right hand, right? And so I saw him in my medical tent, and I'm looking at his hands, and I'm like, whoa, well, like, tell me about why you wrote this on your hand and what's the reasoning behind this? And he told me, like, I wrote this on my hands because if I'm climbing and I'm looking around and like I lose focus and I look at my hands and I read it and I'm like, oh yeah, I'm competing and like pull as hard as I possibly can, right? Like perhaps it's the scene as to why we're injured. Like in a competition setting, absolutely go pull hard. Some of you guys go out, and I've heard the term, you guys are raging. Like, let's go out and let's just rage, right? Daniel Woods and one of his buddies said that when they would head out to climb, like, they're really good climbers. They're really, really strong. They have years, if not decades, of training up those tissues to thrash and bash and mash on them, and they're strong enough to take it and not get injured, right? So here's the things, 3 different things that I've heard climbers tell me that is kind of a red flag that scares me, and I just want to say them so that if you hear yourself saying them, if you hear a buddy saying them, like, whoa, 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 like, let's like pause right there. So the first one is pushing through pain makes you better. It kind of sounds dumb, right? But I've heard people say it, and every now and then my mind tells me the same thing, right? Pushing through pain, if it's a lactic acid pain, if it's an exhaustion pain, it absolutely can make you better in a metabolic way. It can make you better in a keeping your mindset when your body's talking to you way. However, if your finger hurts or you have hot puffy joints, or if your elbow is really shrieking or to you mentally, or if your shoulder feels like it's going to give out and you're trying to, where there's a will, there's a way, push through, like, oh, I'm just going to keep climbing all weekend and next week and just ignore it because that is what's going to make me a better climber, we're missing something, okay? So that's a big red flag. The second phrase I've heard a lot, the pros do it, that's why they're good, right? They go out, they're doing these crazy, like Adam Andre doing these crazy routines that some of you guys and myself have attempted and realize I don't have the strength, the stability, the control to do this, right? Like I'm trying to jump into an elite athlete's training program after 5 years of following a training program, and I have the, how would I say it? It's almost an ego thing, right? I think I'm strong enough, buff enough, I can just jump right in with that person. With climbers, I like to push you guys to think of an elite Olympic level sprinter, right? They sprint the 100 meter, okay? Think of this person. He sprints the 100 meter. What is he doing for training? I'll tell you one thing. He's not sprinting the 100 meter over and over and over and over trying to get faster. That's just going to injure him, right? if you look at what they're doing crazy stuff. They're practicing ballet. They're working on footwork. They're working on strengthening. They're working on mobility. They're doing these crazy balance exercises with wobble boards and endo boards on top of them, and like really technical, difficult stuff that actually pushes their body in different ways beyond how they're actually going to compete with it. So I challenge you to think in those modes of what are other sports doing to push themselves, and I'll be giving you ideas and thoughts and advice as best I can based on yourself and your situation. But it's really thinking for your own body, where am I? And what have I not done that I could benefit from, right? What can make me a better climber, right? What are those weaknesses that I really don't want to think about, right? I just want to push them under the rug. What can I be a better climber if I focus on, even though I don't want to, right? One of the best Olympic marathon runners only runs 30 miles a week, and he does 6 hours a week of training in the gym, strength training, weights, core, circuits, right? Not what he wants to be doing, but holy moly, makes him an awesome runner. So I digress. My apologies. So back to the third thing that I hear in my office: if I stop because of pain, I won't ever climb again, right? It's going to be hard for me to get back to that level. And I've seen climbers that have actually done better. They've become better climbers because their injury has forced them to reevaluate their technique, their skills, and while they're waiting for that to heal, perhaps they're still climbing, right? I've seen climbers that, yeah, I'm working on names. Hold on, I haven't had my coffee this morning. But I've seen climbers that have moved a whole grade up because, like Alex Puccio, she tore her ACL, right? So climbing in a knee brace, it's kind of impossible to do. So you have to try new things, and your brain develops and gets better because of that. I have another climber who tore a ligament in her ankle. She called me and said, "Oh my God, Lisa, I have a problem. It's an emergency." And I said, "Well, what happened?" And she's like, "Well, I was just standing on the wall on this little foot chip, and my ankle gave out." And and I thought, well, it's probably nothing that I can help with, right? It doesn't sound like something that would cause a serious injury, but if you think it's a serious injury, you need to go into the urgent care and have them look at it. Well, it turns out that was the last little bit that her ankle ligament that held her lateral stability stabilizers of her tendons in the groove, and that ligament just decided to finally tear. That was it. Bloop! And she had a major, her ankle just totally gave out, and she did need surgery. But climbing in a boot, she became a better climber and at really working positioning, right? Hips, balance, trying new things. It can help us to progress. So just because you have pain and you stop doing what you're doing in that region doesn't mean you should stop climbing as a climber or stop training and doing rehab and working on things that's going to make you better to get back on that wall. So that's another thing I think is a crutch or reason why people continue to keep climbing on these hot puffy injuries, because they're convinced that they won't climb again, and maybe it's a control thing, or perhaps it's a fear thing. I've totally been there, right? But when you get injured, it's time to create a major training plan for the rest of your body to keep going while your injury heals, okay? So if you injure your finger, there's no reason why you should be sitting on the sofa crying into your Wheaties, right? You should be out there working every part of your body, as climbing specific as possible, and or climbing without that finger if you can do it in a safe way. That's a whole nother topic. And there's so many things you can do to keep pushing yourself as a climber, right? Working on foot smears, working on really good slab where it's just like paint fingers, right? Wet paint where you're hardly using your fingers and you're really using your balance and your stability and your position sense and your footwork. There's so much stuff we can work on while we're healing, okay? So I just challenge you with that anymore. So it's just not enough anymore to come up with these reasons as to why we should still be pushing really, really hard through injuries and copying what these pro climbers are doing, when we need to meet our bodies where they are and beef ourselves up from our weakest points. And that is how we can progress as a climber, as an athlete, and work up through the grades. I really hope you're that climber that's out there in the long run that hasn't blown everything out and is not able to climb when they're actually retired and have time to go on these sweet climbing trips and go do really cool stuff. So with kind of working together as a team, I want you to think broadly of where you pull all of your info from, right? There is a lot of research now on climbing. There are some fabulous free anatomy texts out there. One of them, Netter, Netter. If you just write like left forearm, Netter, and type it into Google search, it'll pull up all the muscles in there. And you can delve through what muscles load into what injury you have and kind of start learning about yourself, okay? Working with your coach and actually telling them where you're at. Training plans, there's so many ways to modify a training plan to make it work for you. And there's so many different mindsets for climbers and for athletes as a whole as to how to create your training plan, right? Some of you guys need to be micromanaged. Some of you guys need to be held back and protected from yourself because you have no self-control. And others of you guys are a little more timid and really need to be pushed and almost whipped to try new things. And then there's this whole realm of climbers that are constantly feeling their bodies and wondering and worrying and not telling their coach where they're at until they've pushed too far and their injury has reared its ugly head, right? Like most tendon injuries are going to tell you long before they become injured. Let me say that again. Most tendon injuries are going to tell you way before you actually have an injury. They're going to start talking to you, okay? So you need to communicate with your climbing buddy, your coach, people that push you, that are those rah-rahs at the base of the climb telling you what to do. You need to be very in control of what you ask your body to do and what you expect out of it, right? Expectations are huge. And then also learning from all these teachers that are out there. You can learn, there's some fabulous teachers that have passed away. One of my favorites is Janet Travell. She she lived right near the Olympic Training Center in Colorado Springs, and she wrote this amazing book, the Travell Trigger Points Manual. And there are two huge books that are like 2.5 inches wide. You do not need to buy the books, but she has all of her info online and flip charts. She's not here anymore. I wish if she was, it's like one of 5 people I want to have lunch with. But she'll show your middle finger hurts, and you flip through the flip chart, and it shows you tight muscles that will refer pain to the area that you're feeling it. So if your middle finger hurts, it may not actually be your middle finger, okay? It could be a referral from a muscle further up in your forearm referring pain down into that finger, okay? It does not have to be a specific local injury. And that, when I first learned that, totally blew my mind. So something for you to think about is Janet Travell. Totally look her up. And there are so many good living teachers out there that have really good information on their websites that you can absolutely learn from. Ask Dr. J, Dr. Julian Saunders, fabulous doc out of Australia. Dr. Jared Vagi's been doing an awful lot of writing. A PT out of the West Coast, fabulous. Esther Smith, another good climbing specific focused provider. She's over near Salt Lake City. I've been lucky enough to work with athletes that have worked with all of these providers. And so they come into my office and tell me what's working and what's not working for them. And so it really is just taking the homework that we give you and working it out with your coach so that they know where you're at, and also making the decision where you are in your cycle, in your training plan, as to, do I implement this now? Do I wait to implement it at the end of my season? Is it something that I just put in like a fine spice that I do a little bit of home care and homework every single day? But this collective genius of all these people you have around you and all this information you have around you, I highly recommend you start learning from it and using it, okay? So solving our injuries, where to start. There's so many options as to where to go. If you have a hot, new, puffy injury, if something's wrong, something feels unstable, I absolutely recommend you start with your MD to get some imaging on that joint or that finger. I'm a huge believer of diagnostic ultrasound, which is the latest thing on the market. So an x-ray is a still shot of the joint, of the bone, to look for fractures and bone spurs and old arthritic damage and huge buildup of scar tissue. We can see all that on an x-ray. But now, this new, within the past 4 or 5 years, is becoming pretty big. We have this new option for diagnostic ultrasound, which you can go to your MD or you can pop over to urgent care, and you can ask them, hey, I've got this climbing injury and I want to know what's going on in there. Climbers are interesting because when we get injured, we start talking about the structural integrity of our fingers, okay? That's a big deal to MDs, especially if we're using our hands a lot, right? Most of you guys have hand-intensive sports, right? We climb, we use our fingers a lot, and you overlap it. Most of you guys are, as I've been noticing with my clients, are quite bright in a work-related sense, and you guys are also using your hands on keyboards for all the work that you do, and so that is a big deal. So when you go to see your doctor, I want you to tell them, I use my hands for a living. I use my hands in my sport. This is very important to me, so they understand, because most people, right, most people you're going to see at the store, they don't really use their hands for anything besides texting on their phone, right, or picking up a shopping bag. So one, you need to really impress upon them the gravity of how much you use your hands and how important to them it is. Two, when you tell them, I heard a pop, or I have this really bad swelling, or my finger doesn't bend now, I would highly recommend bringing up the flexor tendon system with the pulleys that hold those flexor tendons down against the bone for stability and an actual force and load creation in your hands. If you've torn a pulley, or if we think we've damaged something in that structural system, that is a big problem, because we need that to be able to use our hands, right? If you have a pulley mechanism, right, you're belaying your buddy, he's up climbing, he's sticking cams in the wall, nuts, whatever, he's climbing, he falls, and the cam pops. Yeah, that's a problem. If it's above something sharp or something, he's going to land on or deck, that's a problem. But if a few cams pop or a few nuts pop in a row, we kind of have a big problem, right? So that's something to impress upon your MD or your orthopedic doctor you're talking to. I need to know if these are torn or injured, because I rely on my hand, one, for a living, and two, for my favorite sport, which, no, I'm not going to give up, okay? So we need to discuss that with our healthcare team. So super important. I'm just looking. I made this slide, and it's kind of health as a climbing community. I have it up right now, and it's making a plan, right? Sticking to your goals, sticking to your training plan, and modifying it as needed, right? Our goals are not set in stone. If something happens, we have to modify our training plan. We can't just keep forging ahead with what we expected, right? We're constantly testing, checking, and then modifying as needed to try to hit our goals, right? It's like a plane coming into land. A lot of you guys that have a big event coming up, or you're prepping to go on a trip and something's talking to you, this is like landing a plane with a big side wind, right? That pilot is not just sitting up there and not moving his controls around, right? He's twittering with different buttons, and he is changing the way that the plane adjusts to the wind and the air and the landing strip, because you're not going to come in exactly square as expected. Same thing with your training plan and your logbook, right? Body care, making sure you're working on your maintenance, your inflammation control, your flexibility, making sure you're checking in with your family physician once a year to make sure things are looking good from a physiological point. So having blood work to make sure that looks okay. And then also checking in with your maintenance team and your rehab team. If you are one of these people that have been accumulating all of these injuries, it's time to find a friend to help you, or a team to help you start delving through this. You're going to learn a bunch of really cool self-care tricks. You're going to learn exercises to unravel your injury and also keep it from coming back. And then they're going to focus on the inflammation component of your injury. Then they're going to focus on the stability component of your injury to keep it from coming back, right? What failed? What structural stability or strength or proprioception, something failed in order for your injury to occur, right? Unless it was a traumatic injury or the belayer wasn't paying attention, right? No knot at the end of the rope. Like those things we can't control. Like a big chunk of rock coming off the wall, right? Those things happen. However, these chronic tendinitis, tendinosis type things, puffy joints, lack of range of motion, your flexibility starts to decrease in your fingers and you end up with this claw that can't become a fist anymore. That needs to be paid attention to right now, because I want you to be climbing for the long term, and I don't want you to just keep getting worse and worse, not knowing that you're just accumulating contraction, scar tissue, inflammation. When things don't bend, they wear out faster, people. So we need to make sure our joints bend and that the muscles around them are soft and flexible so they don't build up pressure in those joints and make them wear out faster. Because when muscles around a joint are really tight or tissues are contracted and binding that joint, it doesn't get nutrients. It doesn't get mobility. And we've learned in studies of rats that when we fuse joints together for just a couple months, they deteriorate very fast and become pretty much just all bone spurs and arthritis. And that's something that's totally preventable, okay? Another thing because I'm just so big about us as a community, reaching out and showing people by doing things, right? Nice warm-ups. Climbers tend to skip the warm-ups. And with other sports, we do really long warm-ups, right? Like Olympians will, before they run the 100 meter or the 1,000 meter, they warm up for a full hour, right? You don't need to do that as a newbie, but you do need to have some sort of a nice warm-up process that starts to pump blood flow. I don't care if you're doing burpees or jumping jacks, or I love caterpillar crawls. I love flex bars, U-shaped smile frowns. I'll put a nice little link on my website for beautiful warm-ups that I think are a really good idea. May not show up this week, but it will show up soon. But yeah, poke around and see what you can't find is for getting a nice warm-up so you're not just surprised to your tissues, because that's one, they don't soften up and become flexible. Part of that is your brain being protective and guarding. So the more that you start to introduce this nice warm-up, your body is going to relax into it and not hit this informational overload where it pumps out faster and things creak and ache, and you're having difficulty controlling your limbs, controlling your hands, controlling your hips. That's what the warm-up is all about, is breathing nutrition and hydration and motion into these tissues. But a big part of it is telling the brain to allow these tissues it's okay to move, and this is a feel-good thing, that this is good for my body. And just a beautiful warm-up is something I can't recommend. I just can't recommend it enough. So for self-care, there's so many cool things that you can do. I know we talked about going in and seeing a provider, and the biggest thing is just self-control and knowing your bounds, okay? Some people, like the gal on my screen, fabulous climber. She's not risk adverse, okay? Some people love risk. They love to push themselves. Their risk of injuries and of major catastrophes goes up. And then the rest of us are not into risk. We're more cautious, and with that, we have less injuries. However, there's different types of people and different types of needs for you as a climber. So don't feel like I'm telling you don't go out and do risky things, or don't ever go and climb without a warm-up. It might be that your easy climb and doing some basic some small tools you take to the crag to help your arms and hands and legs warm up would be good for you. But even like a 10-minute jog would be a fabulous warm-up for you. So yeah, self-care and learning, they just go hand in hand. Get yourself an anatomy text. Find yourself a healthcare team that you like. I would start at your gym or at the crag, asking people who they see, who they like, and ask them what their experience is. How long do they spend in that clinic, right? Are they there for an hour? Are they there for 5 minutes? How much of the time of them actually seeing their healthcare provider, how much of the time is actually the provider doing hands-on work? and how much of it is the mask actually doing exercises. And if they're doing exercises, I think exercises are awesome, but if they're actually doing them, is that healthcare provider actually watching and providing recommendations on improvements for form and technique? And are they moving up? Are the exercises changing? Because us as a group of climbers, we don't fit in a normal physical therapy setting because we ask so much of our bodies, right? So the average physical therapy setting is usually for someone in their 60s who needs time, like a month, in each phase as they slowly work their bodies and they're pushing them to be able to climb 5 flights of stairs or something basic. So for you, definitely let them know, this is my goal, this is where I need to get back to, and so they can start pushing you aggressively through phase 2 and phase 3 to get you ready to get back on the wall, because you're not the normal athlete. A new climber is a little bit different, but a seasoned climber, you guys need to be pushed a little bit harder, and you need more balancy, positional, rotational stresses and torques and yeah, not just like a basic squat, right? I would have you do like a Bulgarian split squat or something to where you one leg wobble board, reverse lunge, like balancy stuff where you're really pushing yourself as you're working your rotator cuff at the same time to prep your mind and your body for multitasking and for all these funky angular loads that you expect on the wall. So next section, returning to climbing, injury zones. Let's start with my 5 steps for injury recovery, okay? 1, we have to solve what your injury is, okay? It doesn't really work if you're just ignoring it or trying not to pay attention to it, or if you just say it's just a hot, puffy joint, right? We need, if you've been having this for a while, or if it's something that you look at it and it is visibly different than your other fingers, it's worth getting it looked at so we know exactly what's going on. With a caveat to that, with my clients, my virtual clients, I order imaging for you guys. So you don't have to go to an urgent care or an MD before you come see me. And hopefully, depending upon your state, in the state of Colorado, PTs can order imaging, so can OTs, so can DCs, which are chiropractors, so of course your MD can, but we need to get this figured out as to what it is. So I can either order that imaging for you, or you can have a local doc order it, but we need to just make sure you don't have any bone chips, your tendons are attached nicely, we don't have any split tears down the center of your tendons, and that is why I love, again, I keep saying over and over again, it's my favorite thing in the world, diagnostic ultrasound. And when you have your diagnostic ultrasound done, if you're injured enough to need one, make sure they do Doppler. And Doppler is where they put a sensor on there and they just kick the sensor on and it shows what direction blood is flowing, okay? So blue is blood flowing away from the sensor and red is blood flowing towards the sensor or whatever their setting is, and it will show if there's blood flow there. So if they put the probe with Doppler turned on your tendon, and we see, with the Doppler on, we see blood flow where there should not be any blood flow, we know we have tendinitis, new inflammation, or we know we have something else big going on there, okay? So super, super important. If you get an ultrasound, tell them you absolutely want Doppler. In my orders, I always add Doppler in there. So 1, we're going to solve your injury. What exactly is going on with it? That way we can specialize your home care and your strategy to healing it. 2, then we're going to focus on actually healing your injury. This is the hardest part, right? Supportive homework, therapy, things we need to do to actually get that ready to start climbing again or training for climbing, okay? Here's a little tip. If you're trying to heal your injury, you probably should not be hangboarding, okay? Hangboarding adds a lot of load and stress into a tendon and does not help it to heal. So as I've been learning more about diagnostic ultrasound, I've been working on getting my RMSK, which is a registered sonographer of musculoskeletal ultrasound. It's like a physician's ultrasound degree or credential. And what I've been learning in my ultrasound education is when a tendon is healing itself, it picks one of 2 tissues, and I hope you've heard this before in one of my other podcasts. If you don't know I have a podcast, absolutely listen to it. It's called Unsprained. But when you load a tendon and the tendon gets damaged, Let's say you put a lot more load in that tendon than it's designed to bear, and somehow it gets injured. That tendon is going to respond by picking what type of tissue to put into it, okay? And when that tissue is being laid down, the worst thing you can do is be applying a load to it while your body's picking what tissue to lay down. And so this is where I highly disagree. I'm just going to go ahead and say it. I highly disagree with a lot of the hangboard routines for injuries out there, because what I see when you're following these hangboard routines, because I have multiple ultrasounds to back this up, is that I see calcific tendinosis being put down as a response to this load. And what's happening on a physiological level is your tendon is trying to heal. You're putting a too high of a load during the healing process for it to heal. So your body is going to put down a stronger tissue than what was naturally already there. So what we see is this patchy repair job that doesn't match the other tissues, and that patchy repair job, then when you load it again, it tears at the site where the two tissues meet, right? It's like I'm walking on concrete and there's grass right next to me. There's no way I can make the intersection of grass and concrete to be this smooth transition, right? One is grass, the other is concrete. And so you can try as you might to put a little grass in the concrete, a little concrete in the grass. It's not a smooth transition. I hope that works as like a descriptor of this, an example. But so same thing with your tendon. What we start to see is these tears occur where the patch job comes apart from your healthy normal tendon. And when you keep loading it and then it heals, and then you load it and then it heals, and then you load it and it heals, we start to see these tears get a little bit bigger and then a little bit bigger and a little bit bigger, and they become what we call split tears. And I've seen a few of these in my office. They're absolutely terrifying. And I've also been able to ultrasound. So when I see these split tears, I have you guys come back in 2 weeks, and then 4 weeks, and then another 4 weeks, and then another 4 or 6 weeks. And I want to see these tears healing up. I want to see them healing up with the correct type of tissue. And I don't want to see these whiter bodies appearing in your tendon, which is calcium deposits, calcific tendinosis appear, which is a wear and tear process. The other option is your body picks a mucoid tissue, and I've gone on at length about this. So if you're interested, you can pop into my tendon dynamics workshop, which is pretty much how tendons respond to load and how this whole process works. But yeah, we need to work on healing our injury, which is unloading it, supporting it, helping break up scar tissue. With people that get really hot, puffy joints where there's so much swelling that it causes this inflammation. A lot of you guys, your tissues adhere together from the skin all the way down. And all these tissues have gliding properties. So the skin below it has this superficial fascia, and then below that is a little bit of fat, and below that is a deep fascia, and then below that is your muscle belly. And all of these should be able to glide 3D in different directions. Some of them, one gliding right. Let's say one glides, let's look at your forearm, for example. One glides towards your pinky while being loaded, and another one glides towards your middle finger while being loaded, right? There's all this interesting shifting occurring below your tissues as you load and pull with the various positions we get our bodies into. So with inflammation and swelling, when all that gets adhered together and stuck, that is where your healthcare provider needs to, one, teach you how to do this, and or two, you learn how to do it yourself so that we can get in and start breaking this stuff up. And my recommendation is to absolutely tell yourself that this starts from the skin down with your self-care, and I don't want you digging with whatever beautiful, expensive, or affordable tool that you find that you're excited about. The worst thing that you can do is get into that tissue and really start yanking, cranking, and digging on it, right? Because that's, especially if we're talking tendons, that tendon is trying to repair itself, and the worst thing we can do is go in and start grinding on it and drawing more inflammation into that area. The goal is to draw, the old goal, I'm thinking cross friction specifically, the old goal was to friction into that area to bring in more blood flow and more nutrients to help it to heal. And we found a better way to do that now, right? Pump up your blood flow. Go for a run. Do a bunch of squats. Do something to elevate your blood, your blood pressure, and your heart rate will do that. There's also a cool new thing on the market, which is restrictive blood therapy, where you can go in and do compression to strengthen up tendons. And that's interesting and that's new. But going in and frictioning on that area is definitely something we don't want to do. And in my book, Climbing Injuries Solved, and in a bunch of my workshops I have online that you can find through my website, Climbing Injuries Solved, I walk you through these different therapies and how to do them correctly and the caveats so that you don't mistakenly cause more damage than you're trying to heal, okay? So in my 5 steps for injury recovery, the first one, we're trying to solve what actually happened. The second one, actually get the healing done correctly and not be like throwing rocks in chili that we're trying to make, right? We have a specific recipe that we're using to heal you up, and the worst thing you can do is just be like a little kid picking things off the floor and throwing it into that recipe. That is just disaster, and we don't get the results the way we want to. After we heal your injury, this is where preparing to return to climbing is important. You can't just go from my finger hurts to let's go start climbing as if nothing happened. There is all of these guarding mechanisms we're learning about where the brain is protecting and not allowing full muscle contractions or not able to now feel what's going on at the fingertip or how to control that joint through flexion and rotational load that goes into our fingers and our wrists and our shoulders and our elbows as we're pulling. So that's where all that preparatory work comes in. In my book, Return to Climbing, I have I call it Prehab, which is a section for people that are still injured to prepare them while we're waiting for your injury to heal, to prepare them, one, breaking up all the scar tissue and helping to heal your injury, but to get you ready for actually the training that comes with returning to climbing. So I have a whole prehab section on how to prepare your body. And then I have part A, which is the rehab, which comes with introducing your finger to climbing again. And then for part B, so part A is all the rehab for returning to climbing. And then part B is actually taking that injury and having done all the work to back it up, right? We have this big, beautiful pyramid. Our bottom is base. We've done all of this hard work to create a big, beautiful base that we can trust and depend on so we can get you back to actually loading that joint in a climbing specific way. And then finally getting you to climbing, getting your volume up, and then finding that big, beautiful plan to get you back to training for climbing if you have some big goals, which a lot of you do, or you probably wouldn't be listening to this. And with that said, I'm sure you guys have all kinds of thoughts on this. So you're more than welcome to shoot me over at the bottom of this any questions or thoughts or ideas, because one, I learned from you. You guys bring up questions that I haven't even thought of, which is awesome. I just love the questions you guys ask. I also get to know your guys' needs. So if you have questions I haven't addressed, throw out those questions, and absolutely, I will, as best I can, either give you guys a full post on it, or perhaps I will address it on my podcast, or I'll just respond back to you individually, because one, there is no stupid question, and two, if you don't ask it, how are you supposed to know, okay? So the return to climbing after injuring is the hardest, after being injured is the hardest part, because there is this danger zone, and I know I mentioned it with your tendon of we want to push your tendon and your body and your injury and your joint, however your injury developed and healed up, awesome, but we need to find that fine line that we push up to. We could be more gentle and easygoing and take our time if we're not in a hurry, but if you are in a hurry, you're training for an event or something's coming up, we need to find that fine line of supporting your body and doing something that's good for your body, right? Doing something that's in your best interests versus applying this form of training to your body and injuring you, right? Pushing you into that injury zone and taking all the good work that we've done and pretty much just ripping it up, right? Like just take that piece of paper that I gave you of homework and you just yeah, just mash it with your hands and throw it in the trash, or just throw it over your shoulder and walk away. That's the danger zone. And like you, I have been the person where I've tested up to the danger zone, and it's okay to test that joint or that finger or that tendon to see what it tells you, and then to do all the supportive training that gets you up to that point. So, and that's why I'm bringing this up. Volume. So there's the healthy zone, and then there's the injured zone, and there's this big red line that goes right between them, right? So we need to push your body a little bit to see, after we've done your easy volume and starting added in all of your supportive exercises and started getting you ready with I love this new hand web. It's by Kando. I have links to it on my website. But after we start applying all of these loads into your fingers and building up the endurance and ensuring that we can put a pretty high load into your injury and not have it talk to us, be problematic, then we're getting you back on the wall, right? And we're going for basic, easy volume. And I recommend in the beginning you take a day off in between each day of climbing just to see how your body responds and what it says to you. If you get a bad response, that's okay. It's your body telling you, whoa, I'm not ready for this yet, or I missed something in my home care, or this is okay, but I'm worried about it. And bodies they'll give you pain signals and little zaps into that muscle, like little spasms, because your brain is, it's not like you mentally are terrified, but it's your body. Your body is this prehistoric beast that has evolution behind it. And the oldest part of your brain is the deepest, and the most center of your spinal cord and brain is the oldest. And that's the part you can't control. And it's the part that is subconscious and subliminal, and it's nothing that you as an athlete or as a person can control, okay? So when I'm talking about your brain, I'm not saying you are inept or you really need to see a psychologist, or you have depression issues. No, I'm talking about the animalistic old part of your brain, of your neuromuscular system, of your nerves, of your brain that you can't control. And that's the part that we're working with. We want all of our input into this old prehistoric dinosaur computer brain of ours to be supportive. And if our brain sees our work and our climbing and our training is supportive and it likes it, then we progress rapidly. But if we put in this input and this rehab and our body starts saying, I don't know about this, you're getting nervous, you're uncomfortable with it, you finish your workout, you don't feel good about it, that is your body telling you something, and let's just change it. So find something that you feel really, really good about, that you feel like you're doing supportive work to make your body better, and run with it, okay? So we start with volume, and then we start doing these little additions of intensity. So if you're a runner, I would call them striders, where you start really slowly and slowly work up to some speed and then stop again, like 20 seconds. So we'd have you be doing that on the wall. You have big, beautiful volume, climb in nice and easy, and then you just maybe add in 3-4 moves of climbing a little bit quicker, a little bit more powerful, and then stop and go back to easy climbing and maybe do 5 to 10 of those in one night. And that is you just kind of pushing your body neuromuscularly, pushing the mechanical system of your body, and see what it says, okay? So we do all of that before we start moving up the grades, right? This is all on easy climbing. Before we start doing any sort of, like, even remotely looking at that project, right? Like, we need to do all of our other supportive stuff first. So I talk an awful lot. I'm just kind of looking at all my slides. So the next time we meet back, we're going to talk specifically about climber's finger, about rehab for climber's finger. And I'm just honored that you guys popped in to meet with me, and that you guys took the time out of your busy day to come in and take the time to start learning about your body and working on your body. If I could make any recommendations on treating yourself, I would highly recommend one, most climbers don't have a self-care kit. When you get injured, you don't have the means of treating yourself, right? You got to run to the store and get this, get that. So have your self-care kit there in your hands, right? Have an ice pack, have some compression banding, have a finger splint on hand. For your self-care tools, have some stretchy banding, have maybe a wall set up or a setup in your ceiling or from your door that you can do stretchy band rehab for your shoulders, for your full body. I love TRX workouts or suspension training programs just for full body training for stability control, um, management of all those torque and loads, especially on overhang type stuff, just to get your body prepped for it. And I highly recommend getting yourself little tiny rollers that are size specific to work on your forearms. As climbers, we tend to build up these flexion contractions in our flexor tendons because when you pop off holds, that elastic load goes into your tissues. And there's a bunch of research on this from baseball players. And when they connect that bat with the ball, it's when the bat comes off the ball or they let go of the bat is that shock load. And you go from fully loading that muscle to no load at all. And that shock load causes contraction in your tissues, and they get shorter and tighter and shorter and tighter until it loads into your hand and fingers. And so my assumption, I'm not a researcher, I'm a clinician, but just looking at my clients, the tighter the forearms, the more contracted the fingers, the more pulley tendon injuries you have, and the more tendinitis, tendinosis you guys have of those tendons. So it's trying to get you back to where you were before you got injured, stretching things back out and softening things. You don't have to spend a lot of money on tools. There are people out there trying to steal your money, and I see you guys bringing your tools in that you saw advertisements on Instagram or Facebook or whatnot for these fancy hyper ice tools, and they're making a fortune off you guys. So you don't have to spend big bucks. Big bucks being spent doesn't necessarily mean the work is going to get done, right? So you can use like a can of soup. If you're on the road and you're traveling, I really like the cans of coconut water because they're really hard and firm and they're super cheap and you get nutrients out of them as well. You can also use a can of tomato paste. So the trick of the trade is the larger the surface area of the tool, the less hard it pushes, right? So the big foam roller that people commonly know about, those foam rollers are for the back and for the legs. And so the foam roller is about as big around as your leg, right? So when you're looking at your forearm, you probably want a tool as big around as your forearm or smaller. So the smaller the tool, the harder it pushes, the more pressure per square inch. So I really like the can of tomato paste. I would push gently and start softening the tissue. I really like stretching, massage, acupuncture, yoga. I can't say enough about working with your rehab team to get these things solved and get these things healed. And don't forget that you're not alone, okay? I am here if you need any sort of recommendations and help. And there's so many resources out there. I now have my podcast out there called Unsprained, but there's also a lot of really good books, and I really like Ask Dr. J from Rock and Ice. So please do reach out to me. Oh, I'm realizing all of my feedback in the bottom. This is wrong. But please do reach out to me and ask any questions. My website is climbinginjuriessolved.com. And if you have any major issues, I highly recommend, if you're unsure and you have weakness, to go have that looked at just so we can figure out a diagnosis, a correct diagnosis. Because just for an example, yesterday I had someone come into my clinic with a hip problem. And when I looked at her quote unquote hip, it was actually her side. It was her abs, right? And she thought it was her hip. So often when we are self-diagnosing, it's so hard to self-diagnose yourself. I have the same problem. It's hard to know where you're pointing at and what tissue you're actually working on. It's like your body gives you different feedback than someone looking at it for you. So thank you so much for showing up. I have a really awesome tutorial coming up by the end of December of 2021, which is focused on teaching you hand-specific rehab and warm-ups and recovery strategies, and it's going to be using that Kando hand web, which is awesome. So you can go pick one of those up to start prepping for that. And then, yeah, let me know what you thought about today's lecture. I do know I made this a long time ago. It's kind of a repeat. However, information needs to get out there, right? So I thought I would present it again without having to travel. And I just appreciate you guys popping in, and I look forward to hearing what you guys have to say because I learn from you. And if this is something that resonated with you and you think that you have a climbing buddy that would benefit from it, or if sharing it on social media will make a difference, like sometimes these things will change the whole future of somebody that you may not know, or a good buddy you have that's considering stopping climbing because they're always injured, right? And so getting that information out there and almost that hope, right? Of, have you tried this? Have you tried that? Have you considered this? Have you considered that, right? Like, let's form a pact. Let's start doing this warm up together or this unraveling routine together. That may just change someone's life for the better, right? So thanks so much for checking in and have a beautiful night.